Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. Welcome to this happy Monday session of Integrative Movement Insider. This is our new day, and it'll be either early in the morning or somewhere around noontime, depending on what my new schedule tends to be. It's a little bit in fluctuation, so I hope you had a great weekend. I hope your week's started off well. Many of you are back in business. Some of you still aren't back in business, and there's a lot of, discussions are going on around COVID. So wherever you are, I hope you're well, hope you're safe, hope you're still being that leader for your community, because whether you're training online, which we are still doing here, even though we're started to open up somewhat here in Chicago, and we're doing more live training here in Chicago, we're still doing a good portion of it online. So we have our immunocompromised individuals that are still training online, people that are older, and the older population are still training, many of them are still training online, and we're having more individuals come back to our clinic here. Our full-time integrative movement specialist, Sarah Fisher, is back in the office. And again, we're taking all the necessary precautions to minimize the risk of anyone's health. And I should say, to minimize the risk of getting, compromising anyone's health. So hope wherever you are, you're being safe and you're back to business in some capacity. In this past weekend, we concluded part 4 of our series of 2 Anatomy Geeks. Representing 2 Anatomy Geeks here, I'm Dr. Evan Osar, one of the 2 Anatomy Geeks, and my colleague and friend, Jill Leary, is the second Anatomy Geek. This month of 2 Anatomy Geeks, we covered the core muscles. So we talked about the functional anatomy of the abdominals, both the deep core muscles like the transversus abdominis, the psoas, the diaphragm, the pelvic floor, as well as some of the superficial muscles, the obliques, the rectus abdominis, as well as the erectors. So last week we covered the erectors, and this is a very common question, or I should say a common thought process, and a common question we get. Number one is, my client, the back is always tight, they have some low back pain, and you'll often hear things like, your client has weak back muscles, or they just have a weak core and need to strengthen their core. Well, I want you to think about many of your clients, old and young, whether clients train and or don't train, and feel their erectors. What do you normally feel when you palpate their erectors if you do put your hands on your clients, like many of you do? What do you actually feel in their erectors? Do they feel soft and flabby and are flaccid? Not usually. They feel what? Rock hard. I noticed this very early in my career as a chiropractor. I'd be working on these women that didn't work out, and it was mostly women at the time, and many of these women didn't work out. I'm like, man, they have super hypertonic erectors and really well developed erectors, even though they did no quote unquote resistance type training. And I didn't understand it then, but I understand it now. It's really all about strategy and how you use your core muscles to create a more optimal and efficient being a part of an optimal strategy. And when you don't have an optimal strategy, when your client doesn't use an optimal strategy for using their core muscles, when they're not aligning and controlling, when they're not three-dimensional breathing, using their entire cylinder, top to bottom, to breathe, and side to side as well as front to back, they will have very characteristic signs of a non-optimal or suboptimal strategy. Chronic low back tightness, chronic low back pain, hyper or overdeveloped Erector Spinae, very distended abdomen, very shallow breathing, rapid breathing, urinary incontinence, diastasis recti or splitting of the abdominal wall. These are all classic signs of a suboptimal core strategy. And these individuals, when they go to strengthen their core, they're really just strengthening the strategy that they're already using. So your clients that have urinary incontinence, when they go strengthen their core, many of them get symptoms of urinary incontinence. Clients that have diastasis recti, splitting of the abdominal wall, when they go work their core muscles, they get a larger split of their abdominal wall. When clients go work their weak low back, they get more hypertonicity and more chronic tightness and discomfort in their low back. So what's the strategy? It's using the principles of the integrative movement system, the ABCs. A, alignment, B, breathing, C, control. That when you get when you help your client develop a more optimal strategy for aligning their thoracopelvic cylinder, the thorax over top of the pelvis, for breathing, using higher thoracopelvic cylinder in the breathing process, and control, using the strategy at the right time. It's not just about bracing, it's not in, squeezing, tightening things down as much as possible. It's about using the strategy correctly. So in 2 Anatomy Geeks last time, I'm going to take a sip of water right here. This is brand new Anatomy Geeks mug. I'm very excited by this mug. We talked about how to use strengthen the erectors, because my buddy Robert Linkul and I are working on a brand new program we're going to release this fall. I'm super excited about this program too. It's called the Arthritis Training Solution. So we're collaborating together to bring you the best assessments, corrective exercises, and functional training progressions for training clients that have arthritis. We're going to take you joint by joint. And one of the things we did in our pre-con for the Functional Aging Summit is we talked about what do we do for the core. And somebody asked a question on our follow-up webinar. So my client has back pain when they do core exercises. What core exercises do you do? And we get that question very frequently. So I'm going to answer that and also tie it into our 2 Anatomy Geeks where we talked about the erectors. We don't actually have specific core exercises with our clients and patients that come into our office. We just have exercises. Some target the core a little bit more than others, but we just have exercises. Every exercise we do with our clients and patients is with the goal of developing more optimal and efficient strategy, developing a more optimal and efficient strategy using the principles, alignment, breathing, and control. Now let's turn it to erectors. What exercises do we do? Strengthen our clients' erectors. And again, our goal isn't to strengthen the erectors. The goal is to develop a more optimal strategy. So let me show you 3 exercises real quick. One of them is stiff-legged deadlifts. And this is one of the most important patterns I believe you need to do. I don't believe it. I say it and I do it. It's one of the 2 most important patterns that will change people's lives. Number 1, 3-dimensional breathing. Number 2, hip hinging. You have to teach your clients how to hip hinge. And if doctors tell you that their clients shouldn't be doing deadlifts, then well, say they're wrong, but I want you to ask them, how do you bend over and pick something up if you can't do deadlifts? Because bending over and picking something up off the floor is a deadlift, or should be a deadlift pattern. So you have to teach your clients how to appropriately hip hinge so that they can appropriately and safely pick something off the floor. So our pattern, again, we always start with the alignment of the head and neck and thoraco-pelvic cylinder. We always start with the hip hinge. We bring the bar into our hips, bring it up, and then it's just a hip hinge, maintaining alignment and control of the thoraco-pelvic cylinder and not over squeezing at the top. If you do a really good job with your corrective exercises, then this pattern should train the posterior chain without overloading the spine. If your client has pain with that, then they're probably either overloading with too much weight, or you didn't do a good job, or I should say you did a good job, but your client hasn't done a good job doing their homework to maintain that hip hinge strategy. So don't load that pattern until your client has a really clean and pain-free hip hinge pattern. So that's one pattern. Another pattern we'll do for the erectors, because remember the functional anatomy of the erectors, or I should say the function of the erectors, is to help maintain the rib cage over top the pelvis and the pelvis underneath the rib cage. It's to help stop excessive posterior pelvic tilting, because the erectors will go pull you into anterior pelvic tilt. It will stop excessive flexion, because the erectors, when everything's working properly, will elongate you that way, but that's reliant upon 3-dimensional breathing. And the erectors will also stop you from side bending. So another great pattern for the erectors is to do a carry pattern. So we'll do a lot of carry patterns with our clients. So a long spine, stack and align that thoraco-pelvic cylinder, grab your unilateral load, because now you can train the erectors in a unilateral fashion. So now I'm working both sides, obviously, and the entire core, but my right side erectors are working harder to keep that weight from pulling me this direction. So again, unilateral carries are great patterns to teach your client how to maintain thoraco-pelvic cylinder alignment with an asymmetrical load, which is what your client will be doing when they're holding their child, for example, here, or they're carrying a bag of groceries or a heavy box and opening the door with their opposite hand. So it's a very functional to train the erectors. Another function of the erectors is to control rotation. Again, all our core muscles help in some fashion to control rotation. So what the pattern we'll do is a hip hinge with unilateral cable pull. And it's not really even a pull, it's just a hold. But because it's unilateral, we'll start training that rotation, the control rotation, or that anti-rotation motion. But again, it starts with the same alignment, head and neck and thoraco-pelvic cylinder. Grab the load, step back, square up, and now maintain cylinder alignment, and now hinge. And the cable is pulling me into rotation, so my erectors, as well as my other core muscles, are stopping me from over-rotating. So again, this is the basic hip hinge pattern with just a unilateral load on the spine. You can also do a more challenging where you do split stance, and now you're overloading the front side of your posterior chain, also controlling rotation. So a couple variations on how we train the core, how we train the erectors, and why we don't think that you need to strengthen weak core muscles. It's really about developing the most optimal strategy for your client and then progressively loading them up. And that's what we taught through a 4-part series of 2 Anatomy Geeks. So if you're looking for more information on how we train the core, but more importantly, the functional anatomy and why we train the core the way we do, then check out the link that I'll put next. Mary will put the link next to the video. And if you're looking for more information on the Arthritis Training Solution, Robert and I will be sending information out about that in the near future, so stay tuned for that. And thirdly, Janice and I are doing we're taking part in an online conference, the DCA conference. Again, it's shut down this year because of COVID, unfortunately. This is one of our favorite events out on the East Coast. Jamie Nichols and her team at DCAC put on a wonderful event. I think 25 years strong now, and maybe this is even 26 years. Unfortunately, we can't be live, but we're going to be online. And when you sign up using our link, Mary will put the link next to this video, we're going to send you free access to training the female core. And this is a 2-hour presentation Janice and I did last year. So many of these same concepts. How does surgery and having children impact the core? Janice will talk about that. That's her specialty. She'll also take you through the assessments that we do with our clients. And then we'll also show you the corrective exercises that we use based upon our assessments and how to progress your client into some functional patterns. So you'll have direct access to that when you use our link. We'll put the link in next to this video here, and we look forward to seeing you at that online live event. I'll be talking about I believe, shoulder as well as the psoas and glutes. So I hope this episode of Facebook Live served you, and it helped you understand how the erectors work with all the core muscles. It's not just about the erectors, it's not just about transverse abdominis and pelvic floor, it's not just about breathing, it's how the whole system works together to help your client develop their most optimal and efficient strategy, so that way they can safely and effectively accomplish their health and fitness goals, and you become that go-to resource for your current clients and attract more individuals that pay you for your expertise. So this is Dr. Evan Osar of Integrative Movement Insider of 2 Anatomy Geeks. Check it out if you're looking for more information on functional anatomy. We make it learning anatomy. When I say we, it's really Jill, because Janice is always like, she's like, you sound so angry. I'm like, no, I'm just passionate. She's like, no, you sound angry. I'm like, no, I'm just passionate. Jill makes it fun. I bring the passion, which sometimes sounds like I'm angry, but it's just because I'm really trying to get the information across. So check out 2 Anatomy Geeks. We look forward to seeing you on that series. Again, it's all recorded. It's over 4 hours of content. We're working on getting CCs for that as well. Make it a great day. Go out there and serve your community. Be the individual that brings clients together. Don't be divisive. Don't use your platform for your social, for your political views in this manner. Do that separately. Go out there and serve your clients, because there's clients on both sides. There's clients in the middle that need you to help bring them together. So do that and be that leader that our community needs, that your clients need, and your potential clients are looking for as well. Make it a great day. We'll talk to you soon.